2007 and 2008 were problems that were in large measure the result of regulators not doing their job. And I think the people on Wall Street outsmarted the regulators in many respects. But we also learned that there were things where additional regulation was appropriate. But last time I checked, local banks here in Litchfield County, they weren't responsible for the fiscal calamity that brought us to our knees in 2008. And yet the solutions that Congress and the federal government and the bureaucracies have come up with are imposing a very real hardship on our community banks, making them jump through all kinds of hoops when they weren't at the root of the problem to begin with. Now they're being forced to play by the same rules that are being imposed on these giant banks. And it's coming at a serious cost to us because these banks are now spending money complying with unbelievable regulations when they could be using that money to contribute to the United Way or the Girl Scouts, or to be lending to a small business person that has a great idea. And so I think we have to draw a very big distinction between community-based banks that have a long history of serving us honestly and with integrity, and the Wall Street firms, which are huge and which need additional oversight. And so that's where I think we come up with too many one-size-fits-all regulations, and we need to weigh the costs versus the benefits. And in my view, the costs of Dodd-Frank on our local banks far exceed any benefit that might flow from them. And just while we're on the regulation subject, and you're all very good listeners, and I thank you for listening. One of the things that this country is suffering from, in my opinion, is an onslaught of excessive regulations. And I was on NPR yesterday. Did anyone hear me on Where We Live with John Tamkowski? Ted Murphy did. And he said, well, what do you mean? Regulations are good things. I said, yeah, of course, we all recognize that regulations are good things in the right doses. And what I learned in Litchfield a couple of years ago was that it was illegal for one of the great restaurants, and I don't want to single any one of them out because there's so many great restaurants in downtown Litchfield, but it was illegal for them to go to the unbelievable farmers market they have on Saturday mornings in Litchfield. It was illegal for the chef at one of those restaurants to go to the farmers market and buy a tomato, and buy a local tomato. And the Department of Public Health thought that all of our health and safety would be put at risk if one of the chefs went down and wanted to buy a local tomato. And I was called about that, and we had meetings, and we passed a bill saying it's okay for a local restaurant to buy a tomato at the farmer's market. So I want the government to protect me, but I don't want them to protect me to a degree that I can't move, or I can't make a living, or the free enterprise system is brought to its knees. So the Heritage Foundation did this study analyzing what they call super regulations. Now, of course, I said, what the heck's a super regulation? I've never heard of a super regulation. Well, a super regulation is a regulation that causes the industry that's going to be regulated it costs them more than $100 million to comply with. And in the past 3 years, this administration has promulgated 103 super regulations. Now, in all 8 years of the prior administration, there were only 28 super regulations. So 3 years under President Obama, 103 super regulations. 8 years under George Bush, 28 super regulations. Now that slowed me down. It got me to thinking. But then I read further in the study. There are 134 new super regulations making their way through the federal government pipeline that are going to come down and begin to regulate your hospital, your electric company, you name it. More and more regulations that are really having a stifling effect on growing jobs and economic recovery. John, for a second time. John's going back for seconds. Go ahead first.
In the president's health care plan, he severely restricts flexible spending accounts. And they've already restricted health savings accounts and what you can use. As a member of Congress, will you support, or would you think you would support the expansion in use of flexible spending accounts and health savings accounts. And just as an aside, I also understand the president's health plan cuts existing Medicare by about $750 billion. Your opponent has said she supports that plan, so I just found that was of interest.
Well, first on the flexible spending accounts issue. Sadly, the healthcare bill does greatly limit the use of flexible spending accounts. And that's coming at a cost to a lot of families, particularly families with special needs children, who use those programs to help underwrite some of the added costs that they have to incur supporting children with special needs. But on the Medicare question, I tell, when I'm meeting with seniors, I say, understand that $700 billion is being siphoned out of the Medicare system to pay for expanding the pool of people that are going to be covered. And while I think it's a desirable thing for us to work to cover more people, we shouldn't do so at the expense of people that are relying on Medicare to meet their health care needs. And you know, the other thing that's very concerning about the president's health care bill is this IPAB, or the Independent Payment Advisory Board, which is a group of 15 unelected, unaccountable, I don't want to call them bureaucrats, but they're people that are going to be appointed to make incredibly consequential decisions about who gets what health care and how much people are paid. And it's going to translate into more care being available or less care being available. And those decisions are going to be made by people that aren't accountable to the voters and who are insulated. The way it's going to work is they're going to make a decision. Say that they say, okay, we're only going to pay $100 for hip replacement, we the government. The only way that can be changed is if Congress decides to take up a bill talking about how much the government's going to pay for hip replacement. It's kind of like the base closure commission model, but it's being applied to our health care. And I want my doctor and me to have the last word on what health care is right for me, not the Independent Payment Advisory Board in a windowless room in Washington, D.C. And there's a lot of concern amongst physicians about what that's going to mean, from hospitals, because none of us know yet what it will really be like.
And if you're elected to the 5th district, the question would be more on the state level. I know we're talking about federal government. What kind of influence would you exert if you feel it would be a better position on exerting influence over the state legislature and changing their future tax policies?
Well, you know, it's after having served in the state legislature for a long time and having been the ranking member of the, I still am. You're stuck with me as your state senator until January. I've learned, I think, a little bit about where we've gone wrong and where we've gone right. And those lessons are lessons that I will take with me to Washington, D.C. As bad as the fiscal house of our country is, the fiscal house of Connecticut is not good. And we have a lot of unfunded promises that we've made. And each year that passes that we don't honestly deal with how to keep those promises, it's going to make it harder to keep them. And state government has grown very rapidly, and our incomes aren't rising fast enough to support the growth in state government. And as I said earlier, I'll never sit here and say that reducing spending in your town, in your state, or at the federal level is an easy thing to do. It's not an easy thing to do. But I do think it's never been more necessary than it is now to incur the pain to keep ourselves solvent than to incur the pain that we're all going to incur if we become insolvent. So that's, you know, I'm sure you'll be engaging your candidates for state representative and state senator on the issues facing Connecticut, but we're not out of the woods here in Connecticut. And my opinion is that the programs that have been adopted over the past couple of years, rather than making us stronger, have made us even less secure in our futures. And you can see by the number of jobs that we've lost, both locally and across the state. Can I tell you a happy thing? I'll take your question.
I got a question. I got to go back to the health renewal of the president passed a couple of years ago. I just heard you said that that the president took $700 billion out of Medicare.
Yes.
I have heard that many times from many people. But to my understanding, that the $716 billion that the president took out of health care, I do understand that he did not take it out of health care, but he took that money from the insurance companies, from wasteful spending. And he took that money and he probably allocated the money to give better care and to, in other words, to prevent people from, to give you a better care, in other words. But I heard many people say that they take the money out of health care, out of Medicare, and they're gonna let the seniors to don't have enough money to take care of them. But I'm hearing the other side saying he takes money out. Can you probably explain that?
Well, the truth of the president's health care bill is that it will result in $700 billion fewer dollars being spent on Medicare over time. And those dollars are going to be spent for other good things. I wouldn't say that the dollars are going to be spent for bad things. They're going to be spent for good things. But there's going to be fewer dollars available to meet the needs of people who are relying on Medicare. And that's the thing that we need to be mindful of is, can we take $700 billion out of the Medicare system without there being consequences on the quality of care received by Medicare beneficiaries? The jury's still out on that, but I think common sense would suggest that there will be consequences to that. And I would like to see, I don't want to see our seniors paying for health care that is going to other people at the expense of their own peace of mind. But I would like to also share with you something that people have said, what will you do, what's the first bill that you're going to introduce as a member of Congress? And there's, in Connecticut, there's a program called Are You Dense? Has anyone heard of Are You Dense?
Yes.
Joanne has heard of
Yes,
Are You
I have.
Dense? Are You Dense is a program which makes sure that women with dense breast tissue are made aware that conventional mammograms are inadequate as a way to detect early stage breast cancer. Women with dense breast tissue need ultrasounds in order to have peace of mind that this test can actually detect whether there's early stage breast cancer. So in Connecticut, we've taken 2 steps to protect women who have dense breast tissue. The first step we took in 2007, and that was to require that the person doing a mammogram tell a woman if she had dense breast tissue that a mammogram doesn't cut it in terms of being a fail-safe way to detect early stage breast cancer. In 2011, we went one step better, and we said not only are we going to require practitioners to educate women about this risk, we're going to require insurance companies to cover the better diagnostic test so that no one is left guessing about such an important health issue. And if I go to Washington, D.C., the first bill that I'm going to introduce is a bill to give every woman in America the same protection that women in Connecticut now enjoy. I don't think that we should be putting people's health status at risk because they're not getting the right diagnostic treatment, whether it's through Medicare or Medicaid or private insurance. Women with dense breast tissue deserve the peace of mind of knowing that they'll get the tests they need to detect early stage breast cancer. So we have a lot of issues facing us as a country, but as a state legislator, I've always tried to work on issues that matter to us as human beings, that matter to our loved ones, and that's something that I hope to get accomplished.